Hello, my name is Jari Kempers. I'm a health economist, and with this short video I'm going to present you a demo version of a cost-benefit tool that we have built for contraceptive programs. So what is it? It is an online tool that models health outcomes, and it compares the investment needed with the potential cost savings, and so therefore it is a cost-benefit analysis. But more importantly, it is an advocacy and presentation tool, and it is used together with an investment case. So say a 3-4 page document that you hand out to your counterparts in the meetings with the concrete recommendations and short to the point information. So in essence, it is advocacy supported by health economics. So you want to convince the decision makers that the contraceptives are a good cost-saving investment. So some background. So first of all, experienced health economists are in short supply, and then finally you find one and you get your study done. My observation is that health economic reports and studies, they are often, say, underutilized or only used once when the health economist is there and presents the work, and then it is not used anymore. So it's not a very effective way of using these studies. And also my observation is that the medical personnel is often not comfortable of reusing or presenting these studies. So that's why we started to think, well, how could we help? How the health economics work could be used more effectively and say longer. So that's why we built this online tool, and we paid special attention that we limited the number of the inputs what user needs to use, and also we made kind of build up how the results are presented. So in a minute I'll show you the tool itself. So for whom it is, so the target audience, they are healthcare policymakers, Ministry of Health, some countries health insurance, or Ministry of Finance people, and it is used by international organizations or SRH experts, and in general persons who are not health economists. So what we offer is a health economic service. We do data collection that is needed to be done in order to the model to work in your situation. So we collect the data on the contraceptives, contraceptive prevalence rate, the method mix, the policy goals, and so forth. There's also health outcome data what need to be collected, and costing of the family planning services, so cost of providing the contraceptives, and also inputs needed for modeling the averted healthcare costs. We localize the model to work in your country, but what is more importantly, that it needs to work hand in hand with the current advocacy message, what you are currently working on, that they are working together. We write an investment case, so 3-page policy brief investment case for the healthcare decision makers, with the concrete recommendations and straightforward results that they can easily get quickly from the document. And then we will leave you with the online tool. We do the base case, but later you can do your own scenarios and you can save them on the tool. Say your method mix changes, or your policy goal goes up or down, and you can model then yourself the economic impacts of the changes. So I'll show you a quick introduction to the online tool. So I'll show you the user user setup, the inputs for what you need to choose, and then I'll show you the results and the summary. In this video we will skip the advanced inputs to save time. Okay, let's get started. So here I'm going to walk you through the model as you would be using it in your meetings. We have on purpose limited the number of the inputs that the user needs to select. So you start by selecting the time horizon. So typically the year where you have the latest contraceptive prevalence rate data. In this exercise, we assume that it's 2020. Then if your country have, say, 5-year policy goal, so then you choose target for 5 years. If you have, say, 3 years left of the plan, then you choose a shorter time horizon. But here we have 5 years, so from 2020 to 25. We can put multiple countries in the tool. In this case, also Mozambique, but we have here multiple countries already in. You can choose then the geographic area. Typically, countries deal with the entire country, but in some countries where there's a fragmented governmental structures and the procurement of contraceptives is pushed towards the local authorities, you may want to choose a province or even a city, such that your numbers reflect the reality what these decision makers are dealing with. But in this case, we will look at the entire country. Next, you can choose different populations, say all women, or in union. You can also add adolescents, different age groups or vulnerable groups. Here one should not do overkill, one should only choose the ones that you are currently advocating for. In this case, we will look women in union 15 to 49 years old. So the whole forecast is driven by modern contraceptive prevalence rate. So in the setup, we will put the current method mix, so different long-acting and short-acting methods and the current portions. Then you have the policy goal. In this case, we are advocating for 5% increase in the uptake. So then you put the targeted contraceptive method mix for this year. It's all done here in the setup. Then the tool shows you the current method mix and also the population. Say here we have all the women and this is in union what we're actually looking at. So then once you have selected all these, I'll jump right away to the results. This is what you would be then using in your meetings. The point here is that we want to build up the result in a way that the policymakers who are not experts in contraceptives or family planning can still understand this. So here we are advocating for 5% increase from 35 to 40% in 5 years' time users. So what would it mean in terms of family planning users? So in union, this would mean from 1.6 million to 2.1 million in 5 years' time. And what does it mean then in terms of health outcomes if you have a more family planning users? So there's obviously less unintended pregnancies, and because there's less pregnancies, you have less live births and abortions averted. So here we get the numbers for each year, and we have a number of tables for all of them. So then, because you have less pregnancies, you have less deliveries, abortions, so you have a reduction of maternal mortality. So in this case, there would be 3,300 deaths averted in the beginning, and that would increase to 4,400 deaths per year at the end of the forecast. Then there's two sides of the story. You have the investment needed, and you have the cost savings caused by the contraceptive use. So first we saw the cost of family planning services. So first of all, this shows that in these 5 years, one would need $50 million investment. This shows where the money would be spent. So it's mainly injectables and pills, some on condoms. So this is not just the devices or the pills. Here, the costing, what is done as a preparation for the model, it includes then consultations, say you have a intake consultation, you have an insertion or operation, then you have control visits, yearly control visits, or removals, all these things. Also, it depends who is doing these consultations. Is it a midwife or GP or specialist? They all carry different kind of time costs. So this is based on a costing study. Then the other side of the story is the averted healthcare costs, because there are less pregnancies, less antenatal care, and delivery care is needed. There are less complications. There's less unsafe abortion related care needed. So we saw that in the previous step it was $50 million investment was needed, and the potential cost savings during this period would accumulate up to $172,000. So then we bring these together. So this is the investment what you are lobbying for, and the potential healthcare cost savings would be 172. So then these would be then the net savings for the Ministry of Health. So this demonstrates that it would be a very contraceptives would be a very good investment for the money of the Ministry of Health. Then we bring these also together for cost-benefit analysis. So we add the yearly investment needed and the potential cost savings for every year. So obviously this is quite a lot of information for decision maker. So then we want you to be able to wrap up the meeting in a way that they remember things. And here we have these kind of cards. So for the 5 years, you would need to invest $50 million. At the end of the forecast, 2025, you have 2.1 million users. During the whole 5-year period, you would avert 3.6 million unintended pregnancies. Maternal deaths would be reduced by 23,000. The potential healthcare cost savings would be 172 million. And this would mean that the return for investment would be 1 to 3, meaning that $1 spent on the contraceptives would save you potentially $3. So you watched the video this far. I hope you liked the modeling tool. If this is something for your country or for your program, please send me an email and we can schedule another call to discuss the details. Thank you very much for watching. If you would like to see more health economic presentations, please subscribe to this channel. Thank you for watching.